We are in Toronto, in Canada, and I am 99% sure I've torn my pec. So the other day in New York, I was training with Dr. Pat Davidson, and we were doing bench press. I haven't done a barbell bench press in about 7 years now, so I was a little bit apprehensive to it, but I have been pressing using dumbbells, gymnastic rings for push-ups, calisthenic style work, and machines as well. So it's not something out of my wheelhouse to be pressing. And as I was warming up, I felt this slight tearing sensation across the front of my chest here. I started to experience a lot of pain, like a solid 7 or 8 out of 10. And I was like, oh, that's not good. Didn't stop the session there because I thought we've just started. I'm sure that I can work around this, and I didn't want to slow down the workout with Pat because I'm first time meeting him, and I wanted to make sure that I was still able to keep up. So we continued training, went through it all, and it didn't really go away as you'd expect because it was torn muscle there. I didn't notice any bruising, which was cool, and hasn't been any bruising since. But the last couple of days since then, because that was on Monday, and today is Thursday, I did notice just a lot of restriction. When I would flex my pec, it would move a little bit differently, and I just noticed visually there were some deformations occurring, which kind of sucks. It's probably not what you want to have happening at the very start of a workshop tour. I've got to be doing a lot of physical activity and moving around a lot and doing demonstrations, and also just being on the road. So there's something where I need to get it looked at, and I need to potentially get some surgery done as well to fix it up, which is going to be a big challenge here because every few days we are moving cities and jumping around a lot. So anyway, luckily, one of the best things about what I do is I've got a lot of friends and a lot of good networks all over the world. So I reached out to my friend Jordan Shallow, who I'm on my way to go see after this as well, and he put me in touch with Dr. Adeel over in Canada here in Toronto, and heading over there right now to get an ultrasound and to have him take a look at things and see what needs to be done.
I drew. You can see it right over here. So these are the normal fibers.
Yeah.
Pec major, and then you can see. Looks like there might be 2, or is it?
It might be connected.
Connected, yeah. Sometimes when you inject it,
it'll open up.
It'll open up, yeah. But you can see there's 2 holes. Yeah, exactly. There's no issues near the insertion.
I don't think so. I didn't notice anything up there. It was mainly across the sternum that I felt the ripping.
Yeah, the insertion was fine.
Cool. So that's confirms the tear.
Nice.
It's a small partial thickness tear.
All right.
So there's different types of tears. There's partial thickness and full thickness. And the main thing we want to make sure it wasn't a full thickness. So that means the fibers will be completely separated, or the tendon rips off the bone. Right? And so that's not the case. Yeah, so luckily, well, either one's painful, but luckily you don't have that. So it's just a small partial, which will heal on its own, or we can facilitate the healing with the plasma injection.
Right.
The main benefit of doing the plasma is that it'll make sure it'll heal within a certain time frame, versus if you just let it heal on its own, you don't know how long it'll take. You know what I mean? It could heal in 4 weeks, 6 weeks. It might take 12 weeks, and sometimes we have people with chronic tears that don't heal at all, and then they end up needing a PRP after several months.
Right.
So, and there's no real downside to the plasma.
Okay.
Except the cost, I guess. But
yeah,
but we can talk about that too. But yeah, but that's about it. Yeah.
Okay.
So, but the good news.
Yeah. Great.
Yeah.
Fantastic.
Yeah. Yeah. You'll live.
Yeah. Nice.
It sounded much worse when you described it to me.
Yeah. Well, I mean, I felt and heard that kind of ripping, and I was like, oh, what have I done?
Exactly.
I didn't want to look at it. I told Katrina, we're in the gym. I said to her, hey, I think I just tore my pec. Don't tell anyone. I want to keep training. Don't tell Pat. Don't let him see me cry. But
I tried to have a look. He wouldn't let me, and I was like, let me just see if there's bruising. He's like, no, I don't want to know.
You're like the ostrich that buries their head.
Yeah.
I don't want to know.
Yeah.
Yeah. No. It's it's interesting. I think that's the important thing for a lot of people, though. Is like they don't get proper diagnostics, and then they're just kind of in their head. They're like, oh, I probably didn't do anything, or I probably did. You know what I mean? So it's better to get it just checked out.
Yeah.
We know right away.
Yeah.
And then we know for sure. But we also do very specialized and focused ultrasound. It's hard for Like if you went to a regular, like say if you went to a regular doctor,
Right.
and you went and they were just like, they wouldn't even know what to do.
Right.
They would just be like, just go rest it and do some ice.
Yeah.
Like, you know what I mean? And then they would like, and MRIs often miss these small tears too.
Yeah, I was going to say whether it's like what the difference is from MRI to this kind of ultrasound, like which
Yes,
versus
this is
MRI is better.
this is a high resolution
Right.
dynamic ultrasound. So dynamic meaning we're getting to do different maneuvers, so we can actually find out the area of pathology. Versus MRI is a static picture in one position, and so that static picture often misses things, especially subtle tears.
Right.
So that's why we have lots of patients we find that have like chronic injuries that never get diagnosed until we put a probe on them and get them to do the maneuvers that actually aggravate those symptoms. So it's very interesting because like sometimes people can have these nagging injuries and then they're told like, oh, all the imaging is normal, there's nothing else to do, and then there's like to do more physio, and they never get better, and then we actually find subtle things, and
Right.
that's why all the celebrities come here and all the
Sure.
all the top people. So that's our moneymaker. You know what I mean? That's
absolutely.
what differentiates us from everyone else.
Okay.
So yeah. What do you want to do?
Let's juice me up.
Yeah, with your own juice.
Yeah, so what
You'll still be natural, don't worry.
Do I still get to? Am I fat enough to do that stem cell thing?
You don't
Is
need
that
this.
not
You don't need
needed?
the stem cell.
I want it
procedure.
anyway.
You don't have enough fat anyway.
Oh, damn it.
Just wanted you to say that.
yeah. You wanted to get liposuction, but
Yeah, I was
unfortunately,
hoping.
yeah, exactly. So your abs could protrude out a bit more. But
Yeah.
no, you're good. We just need your
Okay.
blood. But
All
we'll use we have our own PRP that we make.
Okay.
So it's a little bit of a process. What we would do is we would take your blood and then you'd come back after 4 hours. So you can
Okay.
go work out, do whatever.
Yeah, yeah.
Just don't work out chest.
Yeah.
Okay. And then when you come back, the blood will be ready, and then we'll use the ultrasound. We'll inject it directly into there.
Okay, cool.
Yeah.
All right.
5 hours later.
Your goal is not to jump or cry or swear. So.
Okay.
All right, ready? Deep breaths. 1, 2, 3, and poke.
Oh, it's not too bad.
Yeah.
Oh my god, that's inside me.
Yes, there's a needle. So just deep breaths, and then now we're right inside the tear.
Yeah.
Oh, it's actually bigger than it looks.
Yeah, it doesn't open up.
You see it filling up?
Yeah, that's not what you want to tell me. You want to say, oh, that's nothing. You'll be back to training tomorrow.
Yeah, it's when tears open up like this. It's doesn't mean it won't heal. It's just bigger than it looks. You see how it flowed all around?
Yeah.
So that's the actual size of the tear.
Heal me.
So it's actually like this whole area, as opposed to
Okay.
what we were seeing before,
Yeah, so
which was like two
two
lines.
dots.
It's just the door going in, the window.
Exactly.
Yeah.
Yeah, exactly.
Okay.
So you're gonna need 2 weeks off for sure.
Okay. Does that mean 2 weeks like no movement in that arm or no loading?
Just in no loading on that chest, but I mean
Okay.
you can still work around. Obviously, you can still
Yeah,
do a lot of
yeah.
isolation work, all that stuff.
Okay.
I'm gonna
Alright.
put a dressing if you can find it.
1 week later.
Today marks 1 week post-treatment and about a week and a half post-injury. And I want to take this quick opportunity now to talk a little bit about how I'm feeling now, a week after getting treated, and how things are going, and also a little bit about how this injury occurred in the first place. Because I think I didn't really talk about that much in this video, apart from just saying that, oh, I was training and then it happened. And I think it's kind of important because it'll help us understand how to maybe avoid this thing from happening in the future, because these kinds of injuries are not great. So I'm currently sitting here in Halifax in Canada. I just gave the first day of a educational workshop, which was a lot of fun. Last couple of days I was over in London, and before that I was in Toronto, where I did see Dr. Khan and also ran some workshops. So it's been a pretty crazy 7 or 8 days or so, doing a lot of very physical activity, and of course the stresses of traveling and moving around. But it's also been a really rewarding week or so. So first of all, this injury, how did it happen? So I was in the gym and I was training and I was doing bench press. Now, for a lot of people, they're gonna think to themselves straight away, oh, you shouldn't have been bench pressing. It was an ego lift. It was a technique thing. The bench press is dangerous and we should never do that kind of thing again. Or even, what were you thinking doing a bench press, and how stupid of you to be doing such a ego-based exercise and jumping into things blindly. Now, that would be a very easy narrative for me to run by, especially when you think about some of the videos I've done in the past, where I'll leave a link up here to one of the videos I did relatively recently, where I was talking about the potential risks of barbell exercises and why I personally have started to go away from a lot of barbell exercises, especially for the upper body. It'd be very easy for me to then go back to that and say, yeah, see, I told you guys so. When you do a bench press, you're gonna rip your pec. But that's not really what's going on here. Okay, because yes, I still do agree that the bench press is maybe a riskier exercise in terms of the joint positions it puts you into, but for all intents and purposes, was it really the bench press that gave me this issue? I don't think so. Okay, if you look at how I approached this session and how I approached this workout, I was quite methodical about this, okay? When I tore my pec, it was on one of my warm-up sets. And not only was it just a warm-up set, it was on the second warm-up set that I did of the same weight increment. So I'm going to put some videos up here and you'll see the first that I did with this 90 kilo weight here, I did 6 reps on and it was pretty comfortable. And then I thought, look, I better be smart about this. I haven't done this exercise in a very long time. I'll do the weight again, despite it moving quite well. So I put 90 kilos back on the bar and I went to do another set and I did 3 reps. And on the 3rd rep, that's when I felt that ripping sensation across my chest and I thought, okay, time to stop. Now, had this have been an issue of maybe overloading with way too much weight above what I can handle, or had this been an issue even of maybe technique or anything like that, then it probably would have happened a lot earlier and I might have gone heavier and I might have been noticeably in a much more compromised position with my technique. So I'm less inclined to be saying that it was the bench press that caused the issue there. There is a chance that maybe had I done exercises that I'm more accustomed to, such as maybe a dumbbell press or some kind of dip or some kind of gymnastic rings, calisthenic style exercise that I've been practicing a lot more, maybe I would have been safer there. So definitely I should have maybe been a little bit smarter about saying, first workout back after spending a long time traveling and being dehydrated and under-recovered, maybe I should be a little bit smarter and choose movements that I'm more accustomed to as opposed to jumping straight in alongside Pat and just following his exact workout. So it's definitely there for myself to say, yeah, maybe I was a little bit overzealous and should have been a bit smarter in considering what else was going on and not thinking of myself as completely indestructible, because clearly I'm not. So what else is going on? So on that day, that was my first workout back after traveling for about 30-ish hours across from Melbourne to New Zealand, from New Zealand to LA, from LA to New York. A lot of time on the plane, a lot of time not moving, a lot of time not eating properly, and a lot of time not sleeping. The week prior to that, we didn't sleep that much either because I was trying to get ahead of the whole jet lag thing and I was shifting my sleep schedules a lot. So on average, for the past week prior to that workout, I was getting at best 3 or 4 hours of sleep each night. Compound that with the fact that I wasn't eating too well when I was in New York for the first few days because we were just exploring and being tourists, and compound that with the fact that I still wasn't sleeping well and we were doing so many extra steps each day. There's a lot going on that's hampering my overall recovery. And not from like an overall muscle soreness perspective, but it is just something that's generating a lot more fatigue. And that can start to mask my ability to train as effectively as possible. So there is just as much of a likelihood of me injuring myself had I done other exercises that I'm more familiar with, not even because of the exercise itself, but more so because of the environment that I was bringing myself into in that workout, as being under-recovered, underslept, underfed, and undernourished, and probably dehydrated some. And I just felt a lot more lethargic overall. So the reason why I say this is there are going to be so many different things that are always going to play into potential injury risk or potential overtraining, and we should definitely be looking at the exercises that we choose, and we should definitely be looking at the training system that we're following in the program overall, but we shouldn't, or we should be very, very mindful of not completely demonizing, say, an exercise like a bench press or even a bench press technique or anything like that. Because yes, there are definitely, from a biomechanical perspective, certain exercises or movements or positions that may be more or less strenuous on the body. But for the most part, the human body is adaptable. The human body can change and develop and respond in a more robust manner instead of falling apart, as long as it has all those other variables considered, such as sleep, nutrition, recovery overall and your activity, and of course load management and technique. So all of those things together, for me, were probably not in the best setting, which is probably why I ended up tearing my pec. Luckily though, as we've already seen in this whole video, it hasn't been too severe and it wasn't a full rupture, it wasn't a full tear. It doesn't require any surgery as far as I know right now. Although I do know when I get back to Australia in about 5 weeks' time, I will get another scan and just see where things are at, because for me, I am quite pedantic about these kinds of things. But in terms of recovery and movement now, a week post PRP treatment, I feel really good. So this is the torn side here. There is no real restriction or limitation in movement, which is really exciting. I haven't gone to do any loading of it just yet, because I do know, like, if I go to like push open a door or pull or just twist my body in a funny way, it does feel still quite sensitive, and I am being mindful of just nursing it with a little bit more extra care. But over the next week or so, I am going to start looking at slowly adding in some very gentle loaded exercise, and I'll slowly start to build back from there as long as it's within my comfort zone and within my thresholds for motion as well. So if you guys want to see more of that, just leave a comment below and I'll make sure I do keep some tabs on the stuff that I do in part of this whole post-injury recovery rehabilitatory process. But yeah, just let me know, otherwise I won't bother making that kind of stuff if you guys won't find it interesting. I'm really surprised because in terms of how it felt immediately after injuring it and for that entire week before I saw Dr. Khan, I was in a lot of pain and I was very worried about my ability to be able to then do anything else. But he assured me, he was like, yeah, look, within a couple of weeks, you'll be back to normal. And I didn't really believe him until the next day where I was like, I feel really good. And then now, a week later, I have pretty much full motion. You wouldn't be able to really tell just by how I move and how I can perform most daily tasks that I have any kind of injury. I haven't done much training whatsoever in the past week just because of how my schedule has been, which is kind of a good thing. Like, I feel like if I was at home or I didn't have so much going on, I'd be obsessing and worrying myself and stressing about my inability to train. But it's been pretty good because I've just been able to focus a lot more on my work and enjoying traveling and sightseeing while being on the road here. Although next week we do have a lot of time in Montreal where we're just going to be chilling out. So one thing, I'll be relaxing a lot more, but in one place I might be able to start training as well. I have been doing a little bit of conditioning and a little bit of just some upper body back stuff that hasn't been loading up my chest whatsoever, but nothing too crazy, just more so going through some motions, nothing through any kind of significant loading at all. So yeah, that's about it. Hope you guys found this video interesting and insightful, and hopefully we've been able to take some kind of silver lining from the dark cloud that is my injury and my pec tear. Hope you guys enjoyed this video. If you have any other questions or comments, drop a comment down below to let me know and I'll get back to you. And for now, have a great day or week or wherever you are in the world, and I'll see you next time.